Hi, everyone. My name is Rubina. I'm with Aspen Dental. Just wanted to thank you for attending this Ask Me Anything session with Dr. Nitin Nirmal. I'm an academic recruiter. I'm with the recruiting team, part of Aspen Dental Management. So we're the support organization for Aspen Dental nationwide. We're here to help our doctors, like Dr. Nirmal, focus on what he needs to focus on, which is patient care. So before we begin, I just wanted to go over a few things. There is a question and answer box on the bottom. So if you have any questions, please feel free to fill that out as we're speaking and going through other questions. You'll often see me looking over here to another monitor, and that's just because that's where I'm directing the question box to, so I can go through them, sift through them, and answer them accordingly and help Dr. Nirmal during the process and essentially just be the moderator. So if you do have any other questions that you don't want asked, you can still ask it in the box and just indicate you want to answer it privately. I'll email you or message you separately. But without further ado, we'll have this Ask Me Anything begin with Dr. Nitin Nirmal, and I'll just have him do a brief introduction on himself.
Oh, hi, everyone. My name is Dr. Nirmal. I've been working with Aspen at their Akron office as a MCD, or the main doctor there. Just a little background, graduated from Loma Linda way back in 2007 and 8. Before that, I was a practicing dentist in India. So I've been doing this for probably around 19 years now. So that's just a little brief from me.
Awesome. So after you graduated from Loma Linda, what were your options coming out of there? Why did you end up choosing Aspen at first, or did you go anywhere else?
Yes. So I was looking at options between a private office and whether a DSO would be a better option for me. And then I started talking to a couple of my seniors and others who had already, either working for DSOs or their own private practices. What I realized was working for a DSO or a dental service organization like Aspen, you actually get a lot better support and mentorship rather than when you're working to clinical practice, because sometimes you're just thrown into it. Whereas with Aspen, they really kind of guide you through what you need to do to grow within the business and professionally and any other way. And the support you get, because there's a lot more options as a DSO. You get to learn more. You get to work under somebody else. You're actually learning a lot better. You're guided in the right way. So that's probably one of my major decision-making processes when I graduated from school.
Wonderful. Someone just asked, going along with that, did you have a mentor when you started? Do you speak to them? Do you still speak to them? And were they easy to access?
Yes. So I was the thing is, when I started, I worked for a different DSO.
Okay.
And then I switched over to Aspen. There's quite a few reasons for that, but we can get into them later on. Even when I joined the other DSO, depends on which one. The one I was in, there was a mentor, but he was in charge of like 4 to 5 practices, which means I was left to be on my own a little bit, but they were still easily accessible. But the big difference I'm seeing with Aspen is you literally have either the practice owner or the doctor who's there pretty much all the time. You have the access to the resources you need. If not anything else, they're there to help you. They got your back, because it's more like a smaller practice, still with the support that you're getting. So that mentorship is always there. Anytime you have doubts, you run into a roadblock, there's always somebody to answer your questions. If not within the practice, you just have to go a little higher, reach out to Aspen. And there's always somebody who's a resource person who knows it or sort of done it. So, and they guide you through everything that you need to do.
Awesome. I just had this asked, if I start as an associate, how quickly can I become a lead dentist? And for those of you who don't know, we call our lead dentists managing clinical directors, which Dr. Nirmal is. So with that, how soon can that transition happen? How did it work for you?
Okay, mine's been pretty quick actually. I started off as an associate for pretty much maybe a month and a half, but mine was probably fairly quick because I was doing it a little while earlier too. But usually what they say is within, I think on an average, if I'm not wrong, Robin, it's within a year, isn't it?
Definitely. Yeah.
Approximately, it's within a year. But again, the potential is within you. As in, depends. Okay, let me get this. The right wording is depends on how quickly you want to grow and how stable you are and with what you're able to do. Because you don't want to pile on too many things. Because when you end up being an MCD, there's a lot more clinical responsibility on your shoulders because you've got to be a lot more surgically strong when you're an MCD than when you're an associate. Because that's what it falls back to is onto the MCD to take care of a few other complications or anything else otherwise. But growing depends on your potential, depends on how you want to grow and what you want to do. There's somebody guiding you the right way. And on average, I guess associate to an MCD is around a year. Once you're fairly, got your feet on the ground.
Right, right. And you said, how long have you been with Aspen total?
Mine's just been a year and a half now
A year
with
and a half.
Aspen. Yeah.
Okay, wonderful. What are you enjoying about dentistry?
Wow, that's a good question. I do like to do a lot more of the cosmetic stuff. I like, as simple as just a filling on the front tooth, just getting the patient back their smile or seeing somebody come in with pain and giving them the pain relief. I think I'm a creature of habit. I literally joke with my patients saying I live at the practice because that's life for me. I wake up in the morning, I look forward to getting to work. So I enjoy, and that's the reason why I didn't specialize because I like my finger in all things. And so I get to do an equal amount of, restorative, prosto, surgical, aesthetic stuff. Aesthetic is a little fewer and far apart depending on the demographic you're catering to or treating, but everything else has been fun. I like doing everything. So it's been a fun ride so far.
That's
In the
awesome.
last 19 years.
Awesome. Going along with that, you mentioned, you just love and look forward to getting into the office. Um, with the office, you have your staff and everything. How involved are you with hiring the office staff, the associates, hygienists, front office? Are you involved? Is it more of kind of the corporate or, our Aspen management taking
Uh,
care of ththings?
there's a fair amount of involvement because end of the day, it's you who's working within the office and it's your team. So I have a big involvement in recruiting or hiring because we're always part of at least in the interview process. The good thing is with Aspen, most of the screening is done before. So we already know what we're looking for. But when it comes to final say yes, pretty much comes down to the MCD and the associate and who's working within the office. Because we're still looking at a very, very it's a good team. You want a good, well-worked or a well-oiled machine, and you don't want one cog out of place. So you want somebody who's conducive to learning, but still willing to pick up a few things and run with it. And so that's what we're looking for, good people to run with the team. So you're looking for the right fit. So we are fairly involved in the recruiting process or in the hiring process, actually.
That's great. And what do you look for when you're interviewing an associate, especially, you'll be mentoring them, working with them?
Someone who's looking to grow, someone who's interested in, doesn't put up barriers saying, oh, I may not be able to do that because the world is your oyster. If you didn't try it out, you don't know if you did it or if you could do it. So we're looking for that, someone for the long run, someone who's more involved with it. And it's all about, end of the day, it's about the patient. It's what we do, what's needed for the patient, what's right for the patient. So we're looking for that. We're looking for somebody who has got the empathy as well as the clinical skill set. And sometimes fresh out of school, we don't have the clinical skill set as we would over the years. But that is always a learned process. We take time. Everybody learns it, but it takes different amount of time and work to get the right skill set that we need. And it's just practice, that's why they call it dental practice. Practice, practice, practice. Right. We always get better. Go back to 19 years ago, I don't think I could ever cut a crown as well as I would right now, or an extraction for that matter.
Right.
But it came with time. So I understand, when you're fresh graduates, we try to put pressure on ourselves, saying, oh, I need to do that in 15 minutes. Forget the time factor. Time is not of the essence. It's the quality of work, because once we get the quality, then everything else falls in place because we get more comfortable with procedures. So that's the whole thing, is it's that willingness to learn new things, as well as spend the time to, sharpen our skills before we pick on something new. Because we always want to make sure that our skill set's good before we add on something new to our skill set.
That's awesome. Awesome recommendations and advice. And going along with that, with the advice thing, is there any advice you give out to a dental student to be prepared coming out of dental school?
Just go back to your basics. Clinically, whatever you learn is what we do every day. Only thing is, it's a lot more quicker sometimes, and it's the real world. It's not as controlled as you would be in dental school. It's a little more, I call it the Wild West when you come out first, when you graduate, because everything seems new. It's not the way we learned by the book, because you want to do it by the book. I know some of them would hate me for saying this. It's never by the book when you get into clinical dentistry. Yes, 80% of the work you do is by the book, but 20% you learn by experience how to do things a little differently to make sure that the quality of work is always there. Because end of the day, it's a human being on the chair, and you've got to do what's right by them. Doesn't matter if you could, because what the patient sees is not whether you did it in 10 minutes or 15 minutes. It's about how good they felt and how good, what they're noticing, which is, the whole procedure for that matter, or if they had to come back in for the same process over and over again. So if you maintain our quality right, everything else falls in place. I hope I answered. I know I segued into other stuff, but
that's so perfect. No,
so.
that is really perfect. What is it, I guess, along with that too, with a new grad starting, what does it look like for them? You've worked with new grads, like
Yes.
associates. What does it look like for them?
Initially, we basically talk and ask, about how long they take for a typical, maybe I'm just going technical details, like a class 1 restoration or a class 2, or maybe a bridge prep. And the good thing about the mentorship program is to figure out how to cater to your capabilities. That's how we set the schedule. The schedule is not set the way I want it. It's set according to the way the associate's comfortable with. Because then we can tweak it, because the longer you get into the process, the easier it gets, because you realize, hey, I thought I could do a crown in 2 hours. Now I can do it in 45 minutes. Just throwing numbers, it's not about anything else.
Yeah.
But it changes. We evolve over time. So what I've seen with a couple of the fresh guys say, oh, I've got to do it in 15 minutes. It's not about the time. First thing is, I always tell it everybody's quality of work. Even if it takes you 25 minutes, 30 minutes, make sure you're doing it the right way. And then comfort to the patient. Those are the 2 main things they're looking. We're doing what's right for them. As long as we do those 2 things, everything else falls in place.
Definitely. Along with that, we do have, like Dr. Nirmal mentioned, a mentorship program. For the first 4 weeks, you're essentially working with your mentor doctor to really perfect everything that he talked about. So associates really aren't left alone until they really feel comfortable.
Mm-hmm.
And just like he said, the times and the procedures, it just works in place. The treatment plans work, everything works in place and in time, just based on your comfort. And
Yeah.
it eventually.
For a long period, you're never flying solo. Even now, I feel there's always that mentorship, because you always know there's somebody else who's got your back in case you run into a roadblock. And that's a good thing about a DSO like Aspen. You've got somebody else who's clinically probably more proficient than you, and you can lean on to them to help figure out, solutions.
Right.
So you're never left to float on your own. No.
Right. And you did talk about treatment plans, and you said, you do your own and the associate does their own. Is there ever like influence from the Aspen Dental Management or the directors or anything like that? Or
none really. It's the key word is doing what's right for the patient, because go back to our basics of treatment planning. It's what's needed. It's not, what they want, as in, you got to make sure we're clinically sound and doing what's right for them. So that's where they leave it up to you, because you still have the clinical independence to do a proper treatment plan. It's not about, oh, we need to have 6 crowns today. No, it's never been like that. It's all about doing what's right for the patient and doing what they need. Right. So it's never a pressure from the management side or the director coming towards you. It's all about being clinically sound and independent. It's all about being autonomous on clinical side. You get the clinical autonomy. Right. There's no one coming and say, hey, why did you do that? Or why didn't you do this? There's never a question.
I just had this asked, what do dentists find frustrating?
Okay, dentists find basically we can do the most beautiful filling or do a beautiful extraction with no trauma and the patient doesn't take care of it at home.
Yeah.
That's the worst thing ever because we're all type A. Most of us are trained and bred to be type A because you want to make it the shiniest, nicest little filling. Patient goes and bites into a hard pretzel, breaks it, calls you 2 days later saying the filling broke. As if it was your mistake. It was never our mistake. We still make sure the product was good. But I guess that's where the frustrating part is, home care. Yeah. Because same thing with the hygienist. I hear from him, Doc, I did such a beautiful SRP. We got everything out, clean. Patient doesn't follow through, comes back with periodontal disease 6 months later. So that's probably where we feel the frustration. Everything else is fine. Yeah. It's like, it's a job too, right? You're going to have its quirkiness in ups and downs. Definitely. Mainly ups is what I feel. That's but the one thing is definitely patient follow through.
Good. How do you feel about the stigma associated with DSOs, and what would you say about them?
Okay, so having worked for a couple different DSOs now, yes, people tend to badmouth a DSO, but really it's not as bad as it seems. It just have to be in the right place at the right time. And within Aspen, you're actually in a very good position for things because they do have your back. It's all about your promoting your growth as a dentist as well as a practice, but making sure you make, you're comfortable, you're happy. Because that's what most, like even on the management side, when they're like, Doc, are you happy? Or what can we do to help you be happy? Which is happiness comes from different things, right? There's monetary, there's professional, there's a whole bunch of things, but they're there to help you out. And that's, it gets under my skin. And someone says, oh God, you're working for a DSO, we heard so many bad things. I'm like, it's not everybody. Yeah. It's like, current situation when you talk about everything, not to bring politics or anything, but everywhere, one bad apple ruins it for everyone. And that's what it is. The stigma is there. It's not about everybody everywhere. Definitely. And that's what I felt, having worked between a couple of different, I call this home. That's what I tell the management, like, that's how I happen. Like, yeah, absolutely. I'm glad I got to join.
That's awesome.
Yeah.
That's good to hear. Do you feel like you've grown? I know you've been with Aspen just a year and a half. Mm-hmm. Do you feel like you've grown as a dentist yourself since joining Aspen?
Definitely in maybe, for me, I guess, having been here, I'm doing it for around 19 years. Clinically, there's only a slower progress in growth. But as a dentist, definitely. Not just clinically, but practice-wise, the way outlook towards things, I've definitely grown, and Aspen's helped me a lot with it. And it's good. It's been a good journey till now. It's been wonderful, actually. It's been a good growth phase.
That's great.
Yeah.
Now, do you do all procedures or some procedures? Do you get to choose? How exactly does that work?
Okay. So as I said, again, when we start as dentists, what we want to do is not always say, hey, I can do everything that's under this planet, right? Because all of us are comfortable with certain things. We've burnt our fingers with certain things in school. So always take baby steps. Never claim more than what you could do. But when you grow into something new, it's always wonderful that you took on something new. So I'm not good with molar endos. I don't do I'll do anterior endos, but bicuspids, I'm very picky because I don't feel comfortable. I feel that an endodontist would do a much better job than I would. And that's the first thing that, even within the practice, there's nobody coming saying, hey, why didn't you do that premolar endo or a molar endo? It's all about what you're comfortable doing. Again, baseline, you're doing what's right for the patient because nobody wants you to spend 4 hours doing an endo on any tooth that's failed and you got to repeat everything or redo things. That's not the goal is. The goal is to make sure the patient's happy and we do what's right for them. So there's no one putting pressure on what you want to do and need to do, is as long as you're comfortable doing it. And that's the biggest thing, is everybody wants to be, it wants you to excel in clinically, but it's basically making sure you have the right procedures that you're comfortable with.
Definitely.
So I hope I answered that.
Yeah, no, that was perfect. And we also have endo and OS, oral surgery.
Traveling, there's a lot.
Yeah, a
There's
lot
plenty
of,
of support.
yeah,
There's plenty of programs to help.
yeah. So we have specialists that come in the offices that,
Mm-hmm.
if you don't want to do that procedure, you could totally put it on their schedule.
Yeah.
And it's all within the Aspen network, so it's nice for patients.
Mm-hmm.
So I just had this asked by a student, if I work for Aspen, will they teach things like surgical extractions, molar endo? I kind of feel ready to go into practice, but I feel like what's taught in dental school is pretty basic and I want to learn more advanced techniques.
Okay. So that's where the mentorship helps a lot.
Yeah.
And then Aspen does have some endo programs. They have implant programs now. Most of us doctors are Invisalign certified. I guess that's a big push we've had. Is a lot of us do Invisalign in the practice, which I never thought 10 years ago that I'm going to be any kind of ortho on my side. And that was a new skill I had to pick up, which, is not too difficult. But even in molar endos, if you're keen on it, they do have help to learn a few things that you would need to professionally develop yourself, and surgically too. That's the key, is where you have the mentorship program. You, as I always said, there's always somebody who's probably a lot more proficient than what we are, that we can lean on to learn something new from them.
Right. And we have all the
And to reach out.
CEs. We have the CEs that are
Plenty of CEs.
Yeah.
You'll be never short of CE programs in Aspen.
Yeah, that are covered. You don't even have to think about payment or anything like
Yeah.
that.
No, it's wonderful that way. Free CEs.
Yeah,
You can't say no to free CEs.
definitely. So I know you had talked about that you were from, or you went to Loma Linda in California. Geographically speaking, did you end up finding work, or did you end up working somewhere that you wanted? Did you have to move? Are you happy with the location?
Okay. When I graduated, I had a couple of offers from a private practice in San Diego. And then I kind of was keen on the Midwest because looking at the lifestyle, I'd been to Michigan for my master's. So I kind of like the Midwest. And so when I was looking at that, yes, I did end up with where I wanted to be, with the demographic that I was looking for. And that's the choice with Aspen. That's the other thing, is if you want to be a practice owner, there's a good pathway to it. And it's a good pathway in the sense they literally hold your hands along the way. So it depends on how you want to grow. You can go from one practice to multiples to anything, but you're in the right place. That's what I would say.
Definitely.
Yeah.
Awesome. Let me see. What hours exactly do you work a week versus when a new dentist, when associates start, are they working more than a lead dentist? How do the hours differentiate? Are they same?
Normally, we tend to keep most of our hours. I think we're around 32 to 35 on an average per week.
Mm-hmm.
I've never hit 40 yet. So it's been good. And there are days where are longer, days that are shorter. Right? And between the associate and the lead dentist, I guess the MCD ends up spending more time at the office than anybody else.
Right.
Because we live there most of the time. A little bit, not saying I live there most of the time. But there's flexible hours. It's a little different the way the schedules are set. On an average, though, you are looking, if you're a full-time employee, yes, you're looking between 32 to 35 on an average per week.
Because do you have the half-day Fridays as well?
Yes, half-day Fridays.
Yeah. So most of
Saturday, 8 to 3, maybe 8 to 1, depending on the week.
Yeah. So
and we do like one Saturday a month approximately. So that's awesome.
Right. So our offices are usually Monday through Friday, the usual 8 to 5, maybe a longer day on one of the days, or like evening hours, and then Friday's half day, and then a Saturday a month. So it's a really good flexible schedule. So what challenges do you face on a day-to-day, and how do you overcome them?
Wow. That's a good one. Okay. All right. Uh, the thing is, there's two concepts. Let me say clinically and non-clinically, okay? Clinically, it's basically not being prepared for the day. So that's a mistake we do sometimes, is always to look ahead and see what's going on for the next day. We can only be prepared so much. It's the Boy Scout motto, right? Be ready for anything. Not really. We can only try so much to prepare, but there's always, if something has to go wrong, it will. And it's usually something that goes wrong fairly large, okay? But that's where you lean back on all your clinical training from school and everything else, and you're usually able to get over it. That's what I would say. Anything, you're trying to pull a tooth and it doesn't want to budge, you're spending 20 minutes. Oh, well, it's a tooth. It's going to do that sometimes. The other thing is you're spending more time with your work colleagues than with anybody else. Usually you're spending 8 to 9 hours in there. So this going to be a little bit of a personality thing. Some people do need a break. So end of the day, you're still leading the team, either as an associate or as a lead dentist. So you've got to figure out how best to help them to kind of, not bring what's troubling them, resolve issues. Maybe that's a challenge sometimes with assistants, be it the lab tech, be it somebody who's upfront, like your front desk or your office manager. But as a team, end of the day, we still got to make the day go well. So that's the good thing, is it's the way you build a team around yourself. Definitely. And the way you adapt to the team. You figure out everyone's quirkiness. Everybody's got a different personality. It's all about making it work. So that's what I would separate as challenges.
Yeah.
And sometimes, even now, after 19 years, I second guess a treatment plan sometimes. Just because it didn't feel right. At that point in time, it felt right, but looking at it later on, but then trust your gut. That's the whole thing. Your gut is never wrong. Gut's like 99% right. It's what felt right to you the first time is usually the right way to go. Because once you start second guessing yourself, you're just going to get into that. It's like the hamster wheel. You're not making any progress. You're only going around in circles, second guessing yourself over and over.
Yeah. Going along with that, I just had this asked, you talked about the team and, working with all of them, getting to know them. Mm-hmm. Are there any suggestions on how to choose a lead dentist or an office to work for? Because during an interview, you don't really know their working style or if it's similar to yours. And you might get more of a sense of that after you work with them. You get more of a sense if you actually work or if you actually get along. So any suggestions on how to even
simple suggestion. Just ask if you can, shadow that office a couple of days. Nobody will say no. That way, you know which office you're getting into. You get to meet the people. You get to talk to them. You get to talk to the MCD. You might have another associate you deal with or a practice owner.
Yeah.
Spend time. And Aspen caters to it. Literally, you can do that.
Perfect.
And you can spend some time. I had the current associate she almost spent 2 weeks with me before even making a decision, on different staggered time. But just because they had questions and you want to see how the flow is, because one day in an office, you never know what the flow of that is. It takes a little bit, a couple of days to figure out how the things are. So that's what I would suggest. Anytime you're interviewing, see if you can spend time at that practice. And with the doctor, even with that group, that helps a lot.
Definitely. Yeah. We allow for all shadowing opportunities. After this, if you guys want to shadow with Dr. Nirmal, feel free to email.
Oh, yeah.
We can make this happen. But it's such a great opportunity, especially, as a student too. You're not really sure. I really think it's very important to check out every avenue, private practice, other DSOs, explore everything that you can, even if it's not in his office. Just explore every option to really figure things out. So now transitioning a little bit into COVID, we had talked about how you actually finally had your first day off today because you've been working the entire time.
Yes.
Can you just elaborate a little bit more on that?
Okay,
what happened when COVID hit?
All right. When COVID hit, things shut down very quickly. Okay, depending on which state you're in. The practice I work for, the practice owner has 4 practices. So he furloughed 3 of the officers and went down to 1 office. And then we worked on a skeleton crew for the first 2 months. It was just me, 1 assistant, and either the office manager or a PRC working. And that's all we were. And it took time to look for, like procedures, processes, what are we doing? The good thing about Aspen was they were on top of it way before us. So that's the biggest support we got, was what Aspen was doing, trying to procure, your PPE, trying to procure materials, everything, everything was shut down, literally, trying to source it is a big thing. And I know private practice owners, friends, relatives, they found it tough to actually, because fortunately most of them were shut down. But when they reopened, to ramp back up and get your supply back in, that's a big struggle. Whereas one big thing I noticed with Aspen was it was always there. I've never felt a shortage of anything. Like just working through COVID. Yes, stressful. Initially N95s weren't available. I'm like, okay, what am I going to do? But somehow, somewhere, shoot an email out, there's always someone procuring N95s for you. It just showed up in the FedEx box. I didn't place orders for it, but it was there. So they're there. They've got your back. And that's the biggest thing I can say, is having worked through it, even though, as she said, I haven't got a day off. In the sense, I worked Monday through Friday without taking a break. I just took Friday and Monday off just to get a little bit away from the practice. Since last September, I've been just consistently working. So I needed the break. So that's what it was. It wasn't about, oh man, he's worked all the way through Sunday, Monday. Wasn't the case.
Right. Sorry. To clarify, we give vacation days, we give 2 weeks holidays, all that stuff. Full benefits, everything is good.
And benefits are good. Okay. Really good benefits.
I just was sorry to clarify. He just was one of the offices that did continue working instead of being shut down. So of course there's vacation.
There's been a paradigm shift with COVID. You got to make sure you're maintaining your cross-infection control. But as I always said, between us friends, when we talk from dentistry, is dentists were the ones who were prepared for this way before COVID hit. We are the only ones who use barriers on everything. The only thing that changed is a couple of the PPE stuff, maybe a disposable gown sometimes, or a bouffant for your head, or an N95 mask, which has become a standard protocol now. Other than that, nothing else has changed in dentistry. We're still doing the same thing. We're still drilling, fill-in, bill-in, right? Or pulling teeth. Nothing else has changed. It's just a few things. So I know people get, wonder, how are you guys managing this? What's happening? If you think about it, we still are as busy as we were before we shut down.
Definitely. Right.
And patients are, coming in, doing what they know, and they understand because we have those practices in place. We have the protocols in place. We're still making sure we're social distancing, still making sure the chairs are broken down right. We don't have back-to-back, patients as much, but we're still doing it. It's just changed a little. We're just adapting to it. That's all it is.
Right.
And so we are way ahead on this than anything else. As dentists.
Going along with that, Aspen, we are the second largest purchaser of PPE in the nation, next to the U.S. government, from like Henry Schein, using Henry Schein as a purchaser. So it's just like, that's how much access, that's how much of an ability we have with our company. And just like Dr. Nirmal said, there was never a moment where he had thought, are we going to be short on PPE? Because it was always there, it's always provided. You did talk about some of the things, not back-to-back patients. What other policies are in place in your office to protect patients and office staff during this time?
It's a mandatory mask rule for everyone. Break rooms, not more than 2 in a break room. Temperatures for everybody, it's taken. And then if somebody suspects that they might have come in contact with somebody, we make sure they're on their 14-day quarantine or, self-appointed quarantine. Only other thing, probably PPE. That's the only other thing that I would say. But everything is the same. We just have added on a few things just to change a few things around. That's it.
Right. Has COVID impacted dentistry for you? I know you said you were working and the office was open, but did you guys do teledentistry at all, or?
Yes.
Okay.
So not in my practice, but I know that a couple of them who were furloughed were brought back in, a few of them, to help with teledentistry. they did do that. I did get one call for teledentistry in all of this. In those 4 months, I had one call for teledentistry.
Oh, wow.
Honestly, I don't know, but we were busy. Every day I've seen patients. The only difference we did was we didn't do anything to do with aerosols until the health department said, okay, you got to do this. So the few other things we had in place is we got the high volume suctions now. There's a couple other isolites have been put into the offices. So depending on the practice, there's a lot more things put in place to reduce aerosol count. So that's probably the other thing that, we have changed post-COVID or during COVID.
Yeah. And you were talking about not really, the patient volume hasn't really changed. Are you seeing any less? Or I know you said you're not seeing patients back to back, but is it still fine production-wise? Is the office still running? It's still alive?
Yeah.
It's not.
Its office is really alive.
Okay.
Yep. As I said, we're doing pretty much as good or sometimes even better than we did last year around the same time.
Wow.
But the only difference is earlier, probably we weren't paying as much attention to staggering patients, but it's still a productive schedule. So what I always say is clinical principle. Running around like a chicken cut with the head cut off doesn't help anybody.
Right.
So you want to work smart and not hard. So again, as I said earlier, with scheduling, with making sure your templates are right, is how comfortable you're doing some things and how smart you work, not how hard.
Yeah.
Breaking a sweat doesn't help anybody.
Yeah.
So it's just, we just had to do a little bit into introspectively looking at things the way we're doing. All we did was tweak the schedule around.
Yeah.
A few things changed. It's still the same.
Yeah. No, that's great. And Dr. Nirmal mentioned furloughed. I just wanted to clarify, furlough versus laid off. Furlough gives the employee still the opportunity to come back, when things get normal. It's just a temporary layoff. You're still, with Aspen, you were still receiving your healthcare benefits, but you were still also able to receive unemployment with the government. It just was a temporary leave until things got normal. Normal, as normal as it could be. But it was also kind of a good benefit that Aspen provided instead of just completely.
Yeah, it was good because Aspen took care of health benefits,
right?
Which is a big thing, especially if you go on to unemployment.
Right.
You don't get that. And that's a tough one. So most of the staff were very happy about it because that was still being taken care of.
Definitely. Yes. Going along with that, not COVID related, but giving back. Charity and giving back is something that's very important to me. Someone just asked this. Does Aspen provide any opportunities for give back?
Yes, there's a lot going on. There's a whole mission section, They do a lot. They do mission services every year. Plus there's the Tooth Mobile that travels quite a bit. So you do, depends on how and when. And then every year we do something for the veterans too. So it's a free dental care day for all veterans, which is really nice. I forget the terminology Aspen uses, but it's nice. It's something that you're giving back.
Yeah.
They have plenty of opportunities for charity, for mission work and charity to give back.
Yeah, I was actually part of it. I think it was when I first started, so about 2 years ago or a year and a half ago, and it was the Mouthmobile, and literally it's just this big truck, bus that goes from one side of the nation all the way to the end, and it just stops at locations that are fairly close to our Aspen locations, and we advertise with the local networks, and we just get so many veterans that can come in and get free healthcare, free dental work. And we have our dentists that volunteer. We have our lab techs that are sitting right outside the bus, making dentures, repairing dentures, partials, everything like that. And it's just like instant work, just instant service for all of these veterans. And it's just like one of the most heartwarming things to see. And we do a day of give back too, and anything that would have been profitable is donated. There's a lot. And then of course the overseas trips, but I don't know when we'll be doing those again with COVID.
Right. Hopefully, soon enough when travel restrictions are taken off. Yeah.
So with your rise to becoming, you became associate to a lead dentist. how exactly did you put yourself in that situation? How did you show that that's what you wanted?
Talk to the practice owner first. During your interview, tell them you're interested in growing, and so they keep an eye on things and touch base on a regular basis. And it's still, I hate to use this word, it's still a business, right? End of the day, it is a business, but
Definitely.
it's still healthcare. You still take it as doing what's right for the patient. As long as you're doing well clinically, they notice things,
Yeah,
you get the opportunity to grow
definitely.
because you're taking on more responsibilities. And each his own, each person's comfortable with certain things. I've come across someone says, oh, I just like doing fillings all day long. I'm like, God, I can't do that all day long. I'd like to do multiple procedures. But there are people who just want to do that. But that doesn't help you grow within the practice because you've
Right.
got to be able to lighten the load for everyone, right? So you're going to be taking on more responsibilities. The more you do, people never say no for you to take on something more. If you
Definitely.
say, hey, so I want to, start doing this, or I want to take on bigger surgical cases, absolutely. And that's where, again, going back, I'm going to segue back onto the mentorship program. It comes back to that. There's always someone keeping trying to help you and look at your growth and help you grow. As long as you show the keen interest in growing, you will grow within the company.
Definitely.
That's pretty much it.
No, that's
That's the
very,
key. That's the
yeah.
secret. Do
um,
what you're doing, but just do it the right way without, don't mess up things. Again, trying to go in a hurry, right?
right.
Take your pace, but do it the right way, you will grow.
Definitely. I just had a student ask, should I go into residency? Did you feel like Aspen gave you enough support not to go into residency? I know your situation's a little different since
Different.
you started with a different DSO and then you
Uh,
also had different education and everything.
Here's what I will say. Depends on how much of a clinical exposure you've got in school because private practice or any practice for that matter requires a certain clinical competency in things. And depending on how you're feeling personally, like, hey, I'm not comfortable doing a lot of the extractions, even simple ones, I find it difficult. Maybe residency is the right way to go for certain people, but it's not the way for everyone. Depends on how. See, I know I'm playing the devil's advocate on this one because it's each personality is different. Depends on each student because I used to mentor students in Loma Linda when I was, once I graduated, even after that, is everybody's different. Some people are so comfortable clinically. I'm like, hey, don't even waste your time on a residency because you got the skill set already. All you have to do is hone it and make it sharper. And that you get the opportunity in any practice. DSOs, especially because you get the mentorship and the support that you need to grow. Certain individuals just haven't got that clinical proficiency as much. Do the residency. It's going to help you because it's all about self-confidence and not overconfidence in things. It
Yeah.
helps you develop a good, firm foundation. As long as your foundation is strong, you can grow in any direction you want. But if you feel your foundation is not strong enough, go ahead, get a residency done.
Yeah.
That'll help you because residencies will throw you. It's like throwing you to the wolves in residencies. But there's always somebody else who's there to have your back again in a residency.
Yeah.
So that's the whole thing. It's all about learning. Okay.
Yeah. Definitely. Thank you for that. Um, Now, I'm not quite sure if you'll know this, but do people who need to quarantine, going back to COVID, someone just asked if people need to quarantine, do they get paid while they're off on quarantine, or it's just kind of,
I I think if they have enough vacation time, they still can utilize it.
yes, I think I
That's
agree.
where it is.
Yes,
And then I'm not sure about further. If you're out of it, I think it's kind of like a furlough. The job is held
yeah,
and everything is good. You
exactly,
just don't get paid for it.
exactly. That's what I thought too. Now, again, now going back into COVID, this is non-dentistry related. It's more of a fun question. If COVID didn't happen, what would your summer have looked like, or what will be the first thing you do when you have full freedom?
Oh, I'll be going on probably a wildlife safari. I'm into wildlife photography.
Oh,
So
wow.
probably I'd have spent half of summer and somewhere on safari looking at wild animals.
Wow.
So
That's,
that's what my summer would have been. Probably, yeah, this year was supposed to be my India trip. everything got canceled, but I like big cats, so tigers, leopards.
Have
That's
you
what I like
taken
to.
have you taken pictures
Yes,
for of them?
quite a few.
Wow,
Yeah.
that's
So
amazing.
right.
That's
So
amazing.
that's what non-COVID summer would have looked like this year.
Yeah, yeah, that's awesome. You'll have to share those with me, and then I'll share it to everyone.
Absolutely, absolutely, absolutely.
That's wonderful. Well, I'm going to wrap this up. I think that's all we have for the questions.
Okay.
So I wanted to thank you, Dr. Nirmal, for attending this Ask Me
Mm-hmm.
Anything and helping out, ask all the or answer all these questions from all of these students. And I just wanted to direct this to all the students that attended that, we're here to help and advise. Dr. Nirmal's here for any further questions you might have. You can totally direct them towards me and I can ask him later. Also shadowing opportunities, just anything you might need just to figure out your journey and what your next steps are, before you embark on your actual dental career. Um, yeah, I don't know if you want to if you have any closing remarks, Dr. Nirmal.
Oh, simple word, dentistry. World is your oyster. It's what you make of it and what you take from it. But be positive, you guys, everyone. You got into dentistry for a reason, but have fun. It's a wonderful journey. It's a roller coaster. Okay, you're gonna have fun when it's going down or up, but have fun. Don't let it get to you too much, otherwise you're gonna stress yourselves out.
Wonderful. Thank you so much, everyone. I hope you guys all have a good evening. And again, contact me for any further questions and I'll be in touch. Thanks so
Yeah.
much. Have a good evening.
Right. Thank you.
Thank you. Bye.